we'll take questions. So, thank you, Peter.
Yes, so it's Peter Russell from Social and Community Health, and I'm on the board of VICSERV. I appreciate that you are probably not willing to divulge anything from the aspect report, but I wonder whether you'd be willing to discuss with us by what process government will use to go about the implementation of whatever those recommendations are. Clearly, you're signaling.
Yep. So it won't come as a surprise to you that, given what I've said, that the aspect report was critical in terms of not so much the theoretical basis of what was done, but the practical delivery of what was done, and has split its comments up into some immediate work and some shorter term work and then some longer term policy work. I can indicate that it is our strong position, and I think agreed across government, that we will implement all of the recommendations arising from that report. Some are immediate. Can I say it was into both alcohol and drug and mental health recommissioning? The fact that there was, the environment of talking about integration and that we had these separate processes is of itself, I think, a key problem, in that what we need to do is to bring those services closer rather than push them further apart. And particularly in the area of intake, as opposed to assessment and treatment, being closer aligned. I don't think that's a shock to anybody, but that was one of the key responses that came from the community sector, that intake is one thing, and it might have well been, particularly in the community mental health area, some actual benefits around the changes to the regional catchment approach. But then that's one thing, the intake and assessment disjuncture from program delivery and treatment services in the community sector wasn't such a good landing, and I think the evidence at a time when we've seen increasing demand and perversely less delivery of service is not a very good public policy space to be in. So rest assured that will be available in the very, very near future, and I apologise for delaying getting it out, but these things take a bit of work internally to come.
Glenn.
Thanks, Vice, from the National. Minister, with the rollout of the NDIS in North-Eastern Melbourne 7.5 months away, we're very keen to hear some timelines from you on, first of all, when you will announce how much will be cashed out of the current MHCSS sector, and also how the transition might work across whatever period of time.
Interestingly, at last week's Disability Reform Council, so the COAG forum, in which the new Minister for Social Services presented for the first time, it was interesting to see the change of language from the new Minister. We're now being told of a development over 10 years to a mature market, not 3 years. 3 years was delusional, frankly. Yes, there will be a rollout of 3 years, and there are key dates as to what that means. But interestingly enough, and then yesterday's comments by Scott Morrison around a 10-year program that the Commonwealth has to find an extra $7 billion for its contributions to the NDIS, I think reflects the reality that a 3-year rollout might be a 3-year rollout, but that the maturity of how the rollout happens is going to take a lot longer than 3 years, particularly if we're serious about not losing people along the way. I'm not putting things off for 10 years. In fact, again, within days, there will be commitments from us about how we support and partner with the not-for-profit sector and others about some of the practical steps that we need to take to resource VICSERV and others in the delivery of the steps, not just in the next 7.5 months, not just in the next 3 years, but beyond, about how we move down that more community-based path. So in terms of how all of that works for the NEMIs and everyone else that needs to get into that marketisation process, or essentially what the NDIS is, we need to make sure that that's done in a way that is resource proper. And we will do our bit, but just to be blunt, there's a multi-million-dollar sector development fund that the Commonwealth is sitting on, that they've allocated $500,000 to all of Victoria to deliver around, whilst our good friends at the ACT, and bless them, received $14 million out of that. So there are some real issues about how, if the Commonwealth is serious of partnering with us to develop the services and the opportunities for those informed market participants in the NDIS to really nail the commitments about what that service changes have to be. And that's before we hone it down to what does it mean in the psychosocial, mental health aspects of how the NDIS plays out. So we will start delivering the northern suburbs, and then in the Loddon, and then in the Central Highlands area, that program. But I don't think rolling it out means that the changes will necessarily all happen in one foul swoop. I think they will continue to evolve, they'll continue to need resourcing. And instead of all that, the Commonwealth has committed to, over the next 3 years, and we have committed budget contributions to more than double investment in this space. And I'd like to think that between us, sector, participants, carers, families, and different levels of government, you could actually do some amount of good with more than doubling resourcing in an area that has been under-resourced. And I think it's up to us to collectively make the most of that, whilst continuing to push for not just a change in how that market operates, but that it is based on quality, that it is based on training, that it is based on an informed and advocated for sector, rather than a lowest common denominator sector, and for our friends from the Commonwealth to make sure that that $7 billion gap that they've identified needs to be filled, so as we can make sure that the NDIS achieves its goals. It hasn't directly answered your question, because it is very much a moving feast, but a moving feast of which I think there is a momentum behind, that all levels of government, even the new ministers, the new federal minister is committed to making sure that those rhetorical commitments that we've all made and those signed agreements that we've all put our signature on are actually delivered. I just don't think it's dawned on our friends at the Commonwealth just really what that means in practice at a service delivery level. I think it has dawned on the NDIA, and that there's a bit of tension in the system between the Commonwealth funding agencies and the NDIA, and what that might actually mean on the ground.
Everybody knows me because I've been standing up front talking to the microphone. Minister, I've heard you speak before about your commitment to workforce and our workforce, but I think that sitting behind possibly Glenn's question is that we've got 7.5 months and we need to come to terms with the industrial relations obligations that we have as a sector. And I'm wondering if you would say something like that. I know I've heard you speak before, but I think people would be encouraged if they hear you thinking that.
Thanks, Kim. I'm a former official of the Australian Services in another life, so I come from a particular view as to what that then should shape us in this sector. There's lots of things in that, but at the high level, if we go down the low road path of a total market approach to this, to the rollout of the NDIS, we run the risk of that lowest common denominator undermining skills, undermining workforce, and undermining competence. And the pillars that would go to that are clearly things like resourcing, particularly not-for-profit, non-government sector, around things like equal remuneration orders, which, whilst it will make a contribution, won't make all the contribution, and having some hurdles for participation in the sector around skills, around quality, and around advocacy, and around rights of people to have access to dispute and service, dispute solving mechanisms at the highest possible national level in a national scheme, rather than a loose collaboration of federated state-based schemes, are all important foundations on which the labour market in the sector needs to be built on. If we have a system whereby we go the low road of a less regulated system, we run the risk of sending the message to the existing workforce that we devalue them, let alone the fact that we expect that workforce to more than double. If we go up the high road of, and I think there is a real opportunity on the back of the learnings from TAFE reforms over recent years, that if we choose that path of commoditising low road there, we will send a very bad signal to our workforce and to you as to what, and let alone the participants in the scheme, as to what that means. And I would be very confident that tomorrow, when the skills ministers all get together around the country, where this issue is well and truly on their agenda, that this will be raised. I don't think the Commonwealth will suddenly give in, but I know that through the work that we are doing at the task force that you're a part of, that there is important work being done there, and that Victoria intends to take a leadership role in what that high road will look like. Because we can't double the workforce through the low road. We could, it'll be based on a 457 home care imported workforce, because the work won't be there otherwise, and that will be a very bad outcome for the sector, for the workforce, but overwhelmingly for people in the system. It needs to be based on a high road, but there are many pillars to that high road. Workforce is one, quality is another, advocacy is another, and disputes and rights enforcement is another.
Thanks, Margaret.
Minister Margaret Combine. I'm interested a little bit in your vision. Most of our organisations also do significant work in the health sector. And really Victoria has led Australia in its movement towards integrated models across the community, mental health sector and clinical services, in delivering better recovery-orientated services within health. And I'm interested in your vision about where that's going to go into the future and the opportunities to create more and more partnerships between our organisations and health services.
Thank you for that. Despite the occasional backward step, I think we'd like to think that that leadership role is still there. People might have had some input into the Parliamentary Secretary for Health, Marianne Thomas's work that she's done about how health and health services and community services can be more integrated. I'd like to think that some of the work that we've started to do with community health organisations in particular as long-term institutional partners in this leadership role, the work they can do. And I'd like to think that whether it's the mental health plan, the integrated community care story, the response to alcohol and drugs, the stuff that my colleague, Minister for Health, seeks to do in corralling more resources, but shifting those resources to that more integrated community-led response is really about how they are the mechanisms, they are the nuts and bolts that will, I'd like to think, deliver on the notion of the vision. If I had to summarise it in sort of an elevator speech, would be that unless we integrate more closely what we invest in as government, community and individuals, families, into a series of services that engage people through housing, through support services where they live, as close as possible to where they live, that what we are doing is condemning them and subsequent communities, particularly those most vulnerable people, of which mental health is but one lens to that vulnerability. We're condemning them to worse outcomes than might otherwise need to be the case. And what we should be doing is through an integrated model of care, of which mental health is one, seeking to build greater civic engagement, greater opportunities for economic engagement based on their right to participate. And given what we understand from the Commonwealth Government's desire to reduce funding to that acute and hospital-based services over the next 4 to 10 years, this is a conversation that we're going to have because the current model simply won't be able to sustain the work that we do now. So not only will we have economic drivers, not only will we have social drivers to shift more of the focus to the community, we will have the reality of billions of dollars of federal cuts driving that. So unless we take the leadership and make that happen on terms that are acceptable to all of us, we will face a crisis, we will face a cliff at some stage in the not too distant future that will see crisis-driven decision making rather than serious planning and conversations happening. So whether that's Minister Hennessy and the work she's trying to do in partnership with health services around shifting some of those resources, whether it's aged care, whether it's alcohol and drugs, whether it's mental health, whether it's community health, whether it's housing and homelessness, whether it's family violence, whether it's young people leaving state care, any number of expressions of how disadvantage and vulnerability plays out in our community, unless we fund those services at a more early intervention, close to where people need them services, we are asking for trouble. And I think the changes that we need to make are pretty well understood and are pretty well shared, particularly in the not-for-profit community sector, in terms of a goal. The real challenge for us all is how do we generate the institutional, political, community momentum for those changes to happen and to stick and to start, continue. They're already happening, but frankly they're not happening fast enough and they're not happening in an enduring enough way to allow the kind of social justice outcomes and the social determinants of health and well-being outcomes rather than other policy driver outcomes, whether they be mental health driven, corrections driven and crisis response drivers. It doesn't exactly answer the question, but I think points as to where we're going.
Yes.
Hi, my name's Martin. I'm a peer support worker at EMI National and North West Mental Health. I was wondering what your view is on the lived experience workforce and its future in the Victorian mental health service. So both consumer and carer workers.
Martin, it's central to that story. If one of the success stories, even if it's not successful enough, of the last 10 years has been the rise of the peer worker and support movement within mental health and wellbeing issues. That challenges all sorts of established methods of operation, and it's pleasing to see that it will be a key part of the 10-year mental health plan outcome. And it was pleasing to see peer workers and peer support workers have a significant input into the development of technical mental health plan. Building on that, building on the rights framework, this is a nothing for us without us approach, is one of the many outcomes that the 10-year mental health plan will point to, and I think that will give us enough hooks in a public policy debate to argue for both the policy and resource responses to follow that. Because it works, because it's the right thing to do, and because it's about consumers. Sometimes I wonder about that term, but I'm there for the sake of the debate that it's accepted and that it brings an understanding with us to what we're talking about, that peer support processes are important, but will only grow in importance in both the near future.
Only one more than Lucky last. Oh, yes.
Dorothy Ford from Compassion Free. I'm just thinking that many organisations have volunteer workers, and volunteers get 60 minutes an hour, and I'm wondering, they're not really part of a marketisation process, and I'm wondering how you're thinking of dealing with these non-marketable but essential community capacity and community development elements, the involvement of volunteers and members of the community in the work.
That's an excellent question, and one that when you shortly see the aspect report, you'll see has come through the recommissioning process as a group that has actually gone backwards in terms of its ability to participate in the resource and institutional arrangements that we've put in place. And I would like to think that I get the notion as to why, unless you put a value on something under the NDIS and under the aged care changes and under a whole range of it, the direction of social policy and human resource policy across comparable jurisdictions, unless you somehow value it in a dollar sense, that you can't really drive reform. But one of the perverse outcomes of that has been consumers, carers and others have faded a bit away in the policy focus that has resulted from that. And the aspect report, when it just comes to alcohol and drug and community mental health, makes some suggestions about how future design needs to bring that group in particular back into play. And I'd like to think that, maybe not so much in VICSERV's realm, but the stuff that we've done in the ICE Action Task Force, that we allocate specific dollars to support and input through that around carers, around volunteers into that space, is a way in which to bring that voice back in a more important way. And I'd like to think that it would be one of the, read the report, one of the co-design voices that we will seek to make sure has input into future policy and program rollout. But can I thank you very much. Unfortunately, for keeping this for health waiting, I'll be even more strife than my already shot to pieces day. So can I wish you well in your important work, and I really do look forward to the continued leadership role that VICSERV rightly plays and will, I hope, increasingly play over the coming years. Thank you very much for your time.